few years ago, the media coverage of Steve Jobs and Patrick Swayze's battle with pancreatic cancer didn't do much to remove the mystery surrounding the disease. Most people don't know much about the small pear-shaped organ located behind the stomach that provides essential digestive enzymes and hormones such as insulin. But about 45,000 people in the U.S. develop pancreatic cancer every year. When cancer affects the pancreas, it may be adenocarcinoma that develops in the cells that line the ducts of the pancreas, or an endocrine cancer that develops in the hormone-producing cells, such as the beta cells that make insulin. For these two forms are treated in very different ways, and adenocarcinoma is generally more aggressive and patients have a worse prognosis. Risk factors for this disease include having pancreatitis or diabetes, being obese or being a smoker, or, as in the cases of Patrick Swayze and Steve Jobs, it can be very difficult to determine exactly what caused the disease to develop in the first place. In the early stages, pancreatic cancer has few symptoms, but as it becomes more advanced, it can cause upper abdominal pain that radiates to the back, loss of appetite, nausea and vomiting, diarrhea and indigestion, dark-colored urine, clay-colored stools, fatigue and weakness, jaundice, and sudden drastic weight loss. If you have any of these symptoms for more than 3 days, you need to see your doctor. Your doctor may suggest tests to figure out if your symptoms indicate cancer or another condition. You may have to have an MRI, a CT scan, or an ultrasound of your abdomen, as well as liver function tests and blood tests. If a suspicious growth is found, a biopsy will be performed. Unfortunately, studies have shown that in more than 80% of cases, pancreatic cancer has already spread at the time of diagnosis, and surgery cannot remove it completely. In these cases, it's likely that the patient will not live for an extended period of time. Sometimes, however, surgery is a smart choice. While there's no proven way to prevent pancreatic cancer, experts suggest those who are at high risk of developing the disease visit their doctor regularly, eat a whole foods, balanced diet, exercise regularly, and if you smoke, you gotta stop. I'm medical editor Dr. Corey Hebert with your Weekend House Call.